Good evening, everyone. Today we would be discussing certain aspects of surrogacy and IVF. So, what is surrogacy? Surrogacy is where, for some reason, a woman is not able to carry her own pregnancy and gets help from another lady to carry the pregnancy, and that is how that lady would be called a surrogate mother. Now, the very frequently asked question to me is that will any genes pass on from the surrogate mother to the child she is carrying? So the answer is no, because here she is just a gestational carrier. She is carrying the baby, however, she is not genetically related to the child. So none of her physical attributes or none of her genetic traits would be passed on to this baby whom she is carrying. Now, the next commonly asked question to me is that is surrogacy legal in India? Yes, surrogacy is at the moment legal in India. It is allowed for all the Indian citizens, not allowed for foreign nationalities. Even Indians who have acquired foreign nationalities will not be allowed to procure a surrogate or to avail surrogacy services in India through IVF. The next very commonly asked question is that how are surrogates recruited? What are the different types of surrogacy in India? Well, right now there are two ways that surrogates can be recruited. Either they are professional surrogates who would be coming through ART agencies, which are designated, or ICMR enrolled agencies who can provide surrogates, or they could be altruistic. That means any of the family members or relatives or friends can opt to become a surrogate for this particular couple. So these are the two ways where surrogates can be, procured, or can be the facilities can be availed. Then the question is that what is the percentage of patients who would be needing surrogacy? So our experience says that it is very small amount of patients who would be needing surrogacy. This could be in the tune of maybe 2 or 3% of all the IVF cycles what we would be undertaking. So these genuine cases who we know that either are born with conditions where a lady cannot carry the pregnancy, or there are certain acquired conditions where she either cannot carry the pregnancy or can be medically unfit to carry the pregnancy. So I would be enumerating, few conditions where these women would be benefited with surrogacy because they don't have any other options. So important medical conditions. The first important medical condition is which is called absent uterus. So if a girl is born unfortunately with absent uterus, it is inherent, it is natural, it is genetic, where the girl has no control over this occurrence. So the girl has ovaries, however, she does not have a functional uterus, does not have a uterus at all. And then this is the girl who later in life can only become mother by availing services of surrogacy. And of course, for surrogacy, she will have to undergo IVF. We will be able to use her eggs. We can stimulate her eggs. We can harvest them with husband's sperms, and we will put them in the womb of a different lady, a surrogate. The other reason is that for certain reasons, like during previous delivery or cesarean, there was a lot of bleeding, which is called postpartum hemorrhage, for which the uterus had to be removed. Now, for any other condition, like if a patient has cancer uterus very early in age and her uterus was removed, now this lady, if she wants to undergo fertility, would definitely need the help of a surrogate. Other medical conditions are multiple fibroids or huge adenomyosis, which has completely distorted the uterine cavity, which has completely distorted the uterus. So you must remember that generally fibroids can easily be removed. Either they don't need surgeries or they can be removed and the uterus can be restored to absolute normal. But there would be certain conditions where patients could be having multiple fibroids. The whole uterus is replaced by fibroids, and no matter how many fibroids we remove, this uterus will never come down to its normal function. Or if in case the internal lining of the uterus is permanently damaged, like in conditions of genital tuberculosis affecting the uterine lining, which is called Asherman syndrome, which has completely destroyed the inner lining of the uterus, or if a patient underwent certain miscarriages and during DNC the lining was destroyed and now the lining is not picking up. And the third condition is huge adenomyosis, where again, the chances of carrying the pregnancy is very high. Then these are the women who again would be needing surrogacy. The other conditions are very severe medical conditions like recurrent brain tumors, like very severe kidney disease, where carrying a pregnancy can be harmful to the lady. Generally, patients with kidney transplants can carry pregnancy. There would be very small sector of patients who might need surrogacy. Extreme cases of heart disease or extreme cases of cancer survivors where they have received pelvic radiotherapy and again the uterus is non-functional. These are the few cases who would be needing surrogacy. And then we have a set of autoimmune diseases which is causing multiple miscarriages and there is no other cause which is found out, like genetic cause or like any other anatomical cause. And we presume that now this lady is rejecting the every pregnancy she carries, and again this lady would be benefited with surrogacy. So very commonly asked question is that, do you make designer babies? When we talk about surrogacy, the answer is no. So surrogacy is only for genuine medical reasons and it cannot be voluntarily opted for. The next is that a question asked is that a person who is very conscious of her figure, will she be taking surrogacy? No, we would not be offering surrogacy to her again. So surrogacy is not by choice, but surrogacy is purely given to patients who have certain medical conditions and issues where the woman cannot carry the pregnancy. So now if we are talking of that, once a surrogate is recruited, what are the different aspects what are looked into when it comes to surrogacy? So different aspects what we look into is, first, a detailed medical history is taken. The surrogate needs to have a valid ID proof stating her age. We normally choose married women with a child of their own. It is okay if they've had previous cesarean or normal delivery, it doesn't matter. They should be between the age of 23 and 35 years, not more than 35 years. Then we cannot recruit them as surrogate. A complete medical history, their personal history, their habits, their children, the well-being of their children is inquired about. A physical examination is done, and then a battery of blood test is done to know that they don't have any medical disorders. Also, we will be checking things like blood sugar, thyroid, all the viral infections which commonly, affect like hepatitis B, C, HIV, VDRL. All these tests are performed on the surrogate. We look at their lungs, and X-ray chest is taken. After the surrogate is investigated, two things which we do at Sir Gangaram Hospital. One is a medical fitness by a physician, and I also get a psychological fitness by a psychologist who interviews the surrogate and ensures that she understands the process and is ready to carry a child for another couple. Once she's found to be medically fit, then we start building up her endometrium. Now, we don't let her own egg grow because we do not want natural pregnancy at any point of time. So, we would be giving her externally hormones. They are very easily given. There are oral medications, and she's called at an interval of about 10 days for the first time, and then every 2 to 3 days till the time her uterus is lining is found to be normal. Now, once the uterine lining is found to be normal, then like any other embryo transfer, how it would help happen for a self patient, we would be, preparing her endometrium and supporting it with progesterone once the endometrium is ready. And then the embryo transfer happens as per the day of the embryos which are frozen. So if it's a day 3 embryo, then it would be after 3 days. If it's a day 5 embryo, then it is after 5 days of exposure to progesterone. And the blood test for pregnancy is also typically done according to the day of transfer of embryo. Now, what is that special diet what a surrogate would be taking? There's no special diet, it is the same. Would there be any special medications? Yes, surrogates need to understand that for the first 3 months they would be on external hormonal support and more medication what they would have ever taken in their own pregnancy. But after completion of say about 8 to 9 weeks of pregnancy, they go on the same medication what any other normal pregnant woman would be taking, and then they would be just taking an iron and calcium with a balanced diet. Now, if the surrogates are staying in surrogate homes, it is very important for the owners of the surrogate homes and the agency to look after their well being. As a doctor, we would be screening the surrogates, we would be doing their medical fitness, psychological fitness, looking after the embryo transfer, antenatally looking after all the well being of the surrogate, and in the end, delivery is in the name of the surrogate. However, the birth certificate is issued in the name of the biological parent. We must understand that when we are talking of biological parent, at least one gamete has to be from the parent who's, for whom the surrogate is carrying the child. We cannot put a donor embryo as per rules in a surrogate, so it has to be one of the gamete. Either both the gametes are of the biological parent or one gamete is from the biological parent. The most important document is the birth certificate, and the birth certificate is always given in the name of the biological parent because legally they are the parent of the child who has been born. So people, need not worry about this issue. The birth certificate does not mention by what mode the delivery had undertaken, and this is how the surrogate always gets admitted and delivered under her own name, and the birth certificate is always issued in the name of the intending parents. Now, it is very important to know that any complications which arise due to IVF procedure or pregnancy must be dealt in and managed by the biological parents and none of the other people. Even for 1 month after delivery, these the biological parents will be looking after any complications which are arising directly due to pregnancy. Now, if a surrogate has a miscarriage, again, the biological parents, the intending parents need to, look after uh, the miscarriage part or the termination of pregnancy. It is very important that these parents or commissioning couples, they understand. What is the role of an agency? Of course, the role of the ART agencies who are providing surrogates is that they need to look after the well being of the surrogate on a daily basis, and the legal contract is made between the commissioning parents as well as the agency, and the documents need to be submitted in the hospital when they start IVF with surrogacy. So I hope I have dealt in with most of the issues of surrogacy and tried to make everyone understand that what this process involves. And now I'll be happy if there are any questions. Yes, so Rashmi, it's a very valid question that is surrogacy more expensive than IVF? Yes, because if you are commissioning a surrogate who is not your relative or from your own, friend circle, then you are paying for surrogacy and it is much more expensive than an IVF cycle, though it varies from one agency to another agency. Well, surrogacy, there's a question from Meha that surrogacy is a different from IVF. IVF is a mode of fertilization and surrogacy is a mode of carrying the pregnancy. They both are very different. Surrogacy is just a form of, or I would say a method by which a woman would be, carrying the pregnancy for another patient. However, she would still be going through the process of in vitro fertilization because it is the embryos what we can put in a surrogate. And yes, this question is asked to me that can we do an IUI on the surrogate? And the answer is no. It's surrogacy better than IVF? No, please do not compare apples and oranges. Surrogacy is just a very small part of carrying the embryo in another uterus. However, IVF is a very, very large aspect and a much more broader aspect. And IVF is completely different. IVF is a mode of fertilization to make an embryo. So 90 8% of patients who are going through IVF would just be going through a plain simple IVF and not surrogacy. So Latika has asked that what is the surrogacy process? I just made everyone understand that how the surrogates are recruited, investigated, prepared for embryo transfer, the pregnancy test, how they are looked after through the pregnancy and the delivery and the birth certificate. So if you listen to my talk, you will get all the inputs about it. Again, Angel, I have already told you that surrogacy cannot be compared to IVF. Surrogacy is a very small part of IVF where we are just putting the embryo in a third and a second lady to carry pregnancy. Thank you so much for hearing me, and we will get back next week.